My name is Abby James, and in this video I'm going to be demonstrating emergency first aid or basic first aid. And in this scenario, the patient came in with a fracture. So firstly, my restrainer here, she's holding the dog's head just to make sure that the dog isn't going to turn around and bite, since it is a stressful situation. So I'm going to start off by putting a muzzle. Okay, and I'm just gonna go ahead and lay him over. And we're just gonna use the towel as a stretcher here. We're gonna go ahead and lift the patient on the table. Okay, so then I would go ahead, being this leg is the one that is fractured, I would go ahead and put a makeshift splint on. So I would put a little bit of cast padding on. And this is just to secure the leg, just until the veterinarian is able to get to it and to address it. So I would put a good layer of cast padding on. Okay, and I would go in with a splint, and then I would take my vet wrap and go ahead and go completely around. Okay, and it is important just to make sure, even though it is temporary, that the vet wrap is not coming in contact with the skin. So I made sure that there is some extra padding around the ends of the foot and the splint and the bandage. Okay, and by this point, the doctor would have been notified, and we would be waiting on the doctor to come and address the situation. My name is Abby James, and in this video, I'm going to be demonstrating basic first aid for a open wound scenario. So the patient here, we've already applied the muzzle. The patient here has a wound on the outside of his leg. So in the scenario that the bleeding isn't stopping after applying pressure for a few minutes, I would go ahead and add a tourniquet to the leg. And I also can go in and apply a pressure bandage to see if that would help with any kind of leakage. And I'm making sure to put enough pressure to stop the bleeding, but not too much to the point where the patient would be uncomfortable or it would cause any kind of issue. And in the scenario that you did have to use a tourniquet, it should be loosened every 15 to 20 minutes, just to allow blood flow back into the leg and to prevent any kind of damage to the limb itself. My name is Abby James, and I'm going to be demonstrating basic first aid on a patient that's been brought in with heat stroke. So firstly, what we would do in this situation is you would want to go ahead and take the patient's temperature and ensure that it is in fact heat stroke that you're dealing with. And once you've taken the temperature, if there's a temperature over 105, that's when you can pretty well confirm that it is heat stroke. So firstly, the first cause of action, you would go ahead and put a cooled wet towel and treatment tables that have a sink or a rack work really well in these situations. And You would just want to put in wet, cool towels around the animal, any kind of small fan just to keep air circulating, and you want to continue rinsing and keeping the towels cool. And as this is going on, you want to consistently take the patient's temperature just to ensure that the temperature is lowering. And that is how you would deal with heat stroke. My name is Abby James, and in this video I'm going to be demonstrating basic first aid on a patient that has been presented with shock. The first thing that I would want to do is go ahead and check the mucous membranes, and that is where I would just press my finger into the gums just to check the capillary refill time. And in a patient that is presented with shock, most of the time that's going to be greater than 3. So secondly, I would go in and I would feel the femoral pulse here and to see if there's any kind of deficit there. And I would go ahead and osculate the heart and lungs, all while holding the femoral pulse to feel for and listen for a deficit. So I'm going to go ahead and do that. Then I would go in and check the patient's temperature just to see what the temperature looks like for that patient. And if the patient were cold, then I would go ahead and give the patient a blanket and try to keep them warm. If the animal was laying unconscious, I would do my best to try to keep the animal flat and as level and even as possible until the veterinarian were able to get there. And after that point, I would assist in whatever the doctor, advised or needed done with the patient. My name is Abby James, and in this video, I'm going to be demonstrating how to do basic first aid on a patient that is choking. So firstly, I would go in and I would check the patient's gum and tongue color, and a lot of times when a patient is getting insufficient air, everything in that direction would be purplish, bluish there. And in a safe manner, once I've kind of confirmed that the patient's not breathing, I would go in and open the mouth and see if I can tell or see if there's any visible obstruction at the front of the throat. And if it's safe to do so, I can reach back and retrieve that. But in the scenario that it is not, and I've already checked the airway and I don't see anything, I can go ahead and do the Heimlich maneuver. So I could go ahead and place both hands underneath the sternum here, right below the sternum, right at the beginning of the stomach, and I would administer blows trying to help the animal release what is obstructing. So I would go in and administer blows as such. And if in the scenario that does not work and the patient is still choking, it is advisable to lay the patient on their side. And you can go in and start laying blows to their side to see if the pressure will push anything blocking out of the patient's. My name is Abby James, and in this video I'm going to be demonstrating basic first aid on a patient that has been presented with a seizure. So the first thing you would want to do is move the patient to a padded area, a quiet padded area, and you really don't want any objects around the patient to prevent any kind of injury. It is advisable to dim the lights and to speak softly to the patient. And if it is safe to do so, you can elevate the patient's head as well. And it is also important to time the seizure so that the doctors can tell what kind of seizure the patient might be having, or if it is a seizure. And once the patient comes out of the seizure, it is important as well to check and make sure that oxygen therapy is not needed. Hi, this is Abby from Bluebonnet. How can I help you? Oh, okay, so he has eaten chocolate. Okay, can I get your first and last name, please? Okay, and what is your dog's name? Murphy, okay. Do you know how much chocolate Murphy would have consumed? Oh, no, that's okay, that's okay. Do you possibly know what kind of chocolate he might have eaten? Or do you have like a wrapper or a container or an ingredient content from the container or wrapper at all? No? Okay, if you possibly could go look for that, I can stay on the line with you. Yes, we do have to know what kind of chocolate, and that's kind of important in these situations as well. Yes, okay. Okay, so you have it. Perfect, and it was milk chocolate. Okay. Alrighty, if you don't mind if I put you on a brief hold, I'm gonna go ahead and consult with the veterinarian and see the next course of action and what they would want to do. But we definitely want to see Murphy in today regardless. So if you could plan to get here as soon as possible, that would be great. Okay. Alrighty, I will be right back. Okay, in this scenario, you know, the dog had eaten chocolate, and it is very important to know what kind of chocolate, the dog's age, breed, size, but I already had, the patient already had a file with us, so I was able to pull up the patient's history, his weight, his breed, and everything that goes along with that. But in this scenario, I would go consult with the doctor and figure out what they wanted to do for treatment, or if they wanted to proceed with inducing vomiting. We would like to see the patient regardless, just to make sure everything's okay, and just so we can monitor and make sure that he's not having any symptoms of any kind of organ issues due to that. But in the scenario that this would be a chemical that was consumed or some kind of poison, we would definitely want to get the patient the phone number for poison control so they could go ahead and speak with poison control, because they see things like this every day, and they kind of deal with things along those lines every day. So, and even in that scenario, we would certainly still want to see the patient. We would just want poison control to be consulted regardless. So that is how we would go about doing that. And typically, if it is a smaller patient, like maybe like a little 10-pound dog, and they've consumed a lot of dark chocolate, we would certainly want to induce vomiting with that. Hi, my name is Abby James, and in this video, I'm going to be talking over basic first aid for a chemical burn or a severe burn. So firstly, what you would want to do with a chemical burn is you would want to try to figure out what kind of chemical the patient had came in contact with. And it is certainly a good idea to go ahead and put gloves on, just so that won't transfer, the chemical burn will not transfer to you. And it is a good idea to go ahead and start rinsing the area with lukewarm water. And as you know, you're in the process of doing this, the vet probably by then would have been consulted and could give further instruction. But it's best to avoid putting any kind of ointment or any kind of soap until the doctor can figure out, you know, what's going on and to give further instruction. In this scenario with a severe burn, you would want to try to administer pain medicine as fast as possible, just to give the patient a little bit of relief. And you would also want to try to cool the area by administering like cool water over the area or the burnt spot, as well as administering oxygen therapy if needed, because depending on the circumstances, with a lot of burn victims, they will also have smoke inhalation and they would possibly need oxygen therapy. So it would be a good idea to start that as well. And it is important not to apply any ointments until the veterinarian has been able to address it and to take a look at it and to give further instruction. And if the patient is in shock or is showing shock symptoms, it is best to try to keep them calm. And if they're cold or starting to get hypothermic, just to go ahead and give them a blanket or try to keep them warm and calm until the next step can be taken.